But my name's Sam. I'm an exercise physiologist based in Sydney, and I am absolutely delighted to be talking to you all today about the role of exercise in cancer care. It's my main interest area as an exercise physiologist, and I really love talking about it. So thank you all so much for having me. As an overview of what we're going to be talking about today, we'll start with what exercise physiology actually is. People often don't know who we are unless they've seen one of us before. We'll go through what the science recommends in terms of exercise and cancer. We'll then go through how much you should do and then how to get started and find support if needed. And we'll go through questions at the end. So in terms of what is exercise physiology, so exercise physiology is a 4-year undergraduate university degree where we learn all about the role of exercise in managing chronic health conditions. So we see a ton of patients with conditions like diabetes, heart disease, Parkinson's, MS, various mental health conditions, the list goes on. We also help people after surgeries or try to prevent injuries before maybe a sporting event or going to the snow. So our role is quite diverse, but it's all about helping people through exercise with chronic diseases or recovering from injuries or surgeries. We differ from physios in the sense that we do not diagnose. So if someone has broken their ankle, they would not come to see me to get a diagnosis, they'd see their physio. And we don't do any manual therapy. So massage, dry needling, that's something that I'd refer someone to a physio for. And we differ from personal trainers. Personal trainers have incredible exercise knowledge, but they tend to be helping people with the general goal of improving health and fitness, whereas we have the university training to help people with chronic health conditions, complex health conditions, or surgical rehabilitation. So essentially, we're just here to use exercise to help manage various conditions. Now, I thought I'd start this presentation with someone who's essentially the leading lady in cancer care, and her name is Prue Cormie. She's an incredible researcher in exercise oncology. She said this on a TED Talk from memory, and she stated that undoubtedly, if the effects of exercise could be encapsulated in a pill, it would be the most widely prescribed medication in the world. And she goes on to say that even if this pill had just a fraction of the positive health benefits of regular exercise, it would be viewed as a miracle drug. Now, what's exciting for me as an exercise physiologist is that there has been a ton of scientific investigations done surrounding the role of exercise in cancer care, and I've attached just some of those works here. But one that I thought we'd cast our eyes to today is the Clinical Oncology Society of Australia's position statement on the role of exercise in cancer care. So this came out in about 2018 from memory. And the main recommendations from this document were that exercise should be a standard component of cancer care, and that the best way for this to occur is via recommendation and encouragement from a patient's multidisciplinary team. And this should also happen through referral to an exercise physiologist or a physiotherapist with experience in cancer care. In terms of where exercise fits in a cancer journey, it fits in all over the place. So it can be really helpful if someone has been diagnosed and know that they are about to start treatment. We often think, I went to a conference a few years ago and we spoke about how there's so much scientific literature about sport, and we can use a lot of that when we're thinking about cancer and the cancer journey. So if there's a surgery coming up or a new treatment regime is starting, we can think of that person as an athlete, and we need to train before that medical event that we're considering like a sporting event or a medical event. So before treatment, we're often building as much strength and fitness as possible before we start treatment and might not be able to be as active as usual, or before a surgery where you do need to rest for a long time to let your tissues recover. You're in a much better position if you've built your strength and fitness than if you hadn't done that. Exercise is really important during cancer treatment as well, whether that's oral medication, intravenous medication, radiotherapy, at a lighter intensity closer after surgery, depending on the extent of the surgery, and then after cancer treatment. Exercise is also important, sometimes to manage longer term side effects that can linger, like cancer-related fatigue or pain that we will talk about today, to rehabilitate after a surgery or build strength and fitness or the confidence to get back to activities that people enjoy. Exercise has a role in all of these parts of the cancer journey. Now, we all know that exercise is good for us generally. And if we go over those benefits to start with, we know that exercise is really important to improve your heart and lung health. So specifically, your fitness exercise is important for your heart and lung health. So walking, swimming, cycling, anything that gets you out of breath is important for your heart and lungs. Exercise helps support a healthier body composition. So making sure that the buildup of your body is as healthy as possible and you've got muscles. We're working on your bone density and things like that. Which brings me to the next point. Exercise, in particular, your strength training and impact training is really important for supporting your bone mineral density. It is really hard to increase your bone mineral density with exercise. It can be done. It is very difficult though. Exercise is important for improving your fitness. So again, fitness exercise that makes you out of breath improves your fitness. Exercise can improve your strength or your muscle health. And it also reduces your risk of developing other health conditions like heart disease, type 2 diabetes, etc. However, there are also cancer-specific benefits of exercise. So exercise is like medicine, and there's a certain dose that's required to see a certain outcome. And that's, I guess, where exercise physiologists come in. We're trained in what the dose is required to achieve specific outcomes. Now, this table can be quite hard to read, so I've summarized this in the following slide, but this is was developed by ACSM, which is the American College of Sports and Medicine. And what they've done is they've gone through the literature and outlined the outcomes that exercise can improve for people with cancer. And it says there's strong evidence backing up and then moderate evidence backing up. So to summarize this in a more legible way, there is strong evidence showing that exercise can be really helpful in managing cancer-related fatigue, health-related quality of life, physical function, so your ability to do various activities, symptoms of anxiety and depression, and help manage lymphedema. And there is moderate evidence that among people with cancer that exercise can help with bone health and with sleep, which is fantastic. So exercise is fantastic generally, but there are unique benefits that are specific to people with cancer. There is a certain dose response that I mentioned before. So there's a certain amount that is recommended that people with cancer do. And these outlines, well, they're on the next slide, but what I thought I'd start with are some important definitions. So physical activity and exercise are actually different when we're talking about it in a health sense, but they all kind of come together. So physical activity is anything that makes your heart beat faster. So walking around the shops, housework, things like that. Exercise is structured physical activity done with the intention to improve your health and fitness. So you put time aside to do exercise, whereas you might get physical activity done throughout everyday life. Both of these count and both of these should be celebrated when you're thinking about how much you've done in your week. But often to get enough movement done to achieve various health outcomes like improve fatigue or improve your pain or improve your strength, we often need to be doing this structured, intentional movement, which is our exercise. So the first big main overarching banner when we're talking about exercise for people before, during, and after cancer treatment is to avoid inactivity and be as physically active as you can. So if you can't reach these exercise guidelines, that is okay, because the main banner is to do as much as you can. Then if we go into a little bit more detail, your exercise guidelines are split into your aerobic or your fitness exercise, and then your resistance or your strength exercises. If we start with your aerobic exercise, like I alluded to before, this includes your bike riding, walking, swimming, skiing, running, anything that makes you breathless. When we're talking about how hard we're working with our fitness exercise, this matters quite a lot, and we use the talk test to decipher how hard people are working. So if you could sing a song while on your walk, maybe I'm on a very flat walk and I'm walking quite slowly and could sing a song, that's considered a light intensity. If you couldn't sing a song because you'd be too out of breath, but you could talk, so maybe I'm on a walk with my friend, I can tell a story. I'm out of breath every few words, but I can tell them a story. That's considered a moderate intensity. And if you can't talk or sing because you're working so hard and you're so out of breath, that's considered a vigorous intensity. These exercise guidelines recommend that if you can, you want to try to be in that moderate to vigorous intensity difficulty level. There are still mental health benefits of doing that light intensity fitness exercise, but to improve your heart and lung health, you do want to be at a difficulty level where you can't quite sing. So in terms of how much to do, they recommend 150 minutes per week at a moderate intensity or 75 minutes per week at a vigorous intensity. So that's about 20 minutes, 5 days a week. For your strength training, so your fitness is great for your heart and lung health, which is also important for your ability to go for walks with friends and do activities like housework or gardening that require fitness. Your resistance exercise is all about your muscle and bone health. And that's also important to make sure that you have the strength to do meaningful activities and also making sure that your body has enough muscle. We don't want to become what's called sarcopenic, because when you lose a lot of muscle mass, it's important that we have enough muscle to do meaningful activities and activities of daily living. Resistance exercise or strength training is traditionally done in a gym with weights. That's what people are often most familiar with. We've got a picture of a barbell here, but you can also do resistance or strength exercise, same, different words, at home. And we've got a picture of someone doing a squat here. I've got some resources later in the presentation of some strength exercises you can do at home, but traditionally we often are familiar with a squat or a push-up. And the guidelines recommend doing whole body strength training 2 to 3 times per week. And when we say whole body strength training, it means in each exercise session, you want to be using all the major muscle groups. So if we think about your upper body, your lower body, and your core, as an oversimplification, are your general larger muscle groups. You want to try to use those 2 to 3 times a week. And we've also got this little person is meant to be balancing. It's also really important to keep up your balance training to reduce risk of falls, particularly if we're considering the prevalence of lower bone mineral density, particularly in neuroendocrine cancer, but common across lots of different types of cancer. Having good balance is very important. But if you are doing balance training at home, you always want to make sure you're not at risk of having a fall. And that's where it could be good to get some extra support with an exercise physiologist or a physio with experience in cancer care to get you started. So that was a lot. The main point is you want to do something is better than nothing. Fitness work, aim to over time, once you've started exercise, aim to try to do 20 minutes, 2 to 3 days a week. And with balance training, the more, the better. And we've got examples coming up of what these could be. Now, with all conditions, there are safety considerations that we must keep in mind, and we've got specific safety considerations for people with cancer. So, as an exercise physiologist, if someone's starting a new exercise routine, I always want to know what their comorbidities or other health conditions are. So, in particular, I really want to know if someone has a heart condition. If so, I want to know how well it's controlled. In general, if you do have a heart condition and you want to change your exercise levels, particularly with that fitness exercise, because it's stressful in a productive way for your heart and lungs. But if you have an existing heart condition, it's always a good idea to get medical clearance from your GP before changing your exercise routine. I want to know if anyone has type 2 diabetes and make sure your blood sugar levels are well controlled with exercise, and know generally if there are any other injuries or anything. But they recommend if starting a new exercise routine, try to gain medical clearance from your GP. Well, definitely gain medical clearance from your GP before starting a new exercise routine. We want to know about bone health in terms of bone mineral density and whether or not there are any bone metastases present, and if so, what type of bone metastases they are. So we understand how hard we should push those bones. And what your fatigue levels are like to make sure that we are exercising to help manage your fatigue levels and not take away energy from other activities you're doing in your day. Exercise is well established in the literature as one of the many fatigue management strategies out there, but it's only one of them. So if you're interested in joining the Living with NETS program, I highly recommend listening to the occupational therapist's chat about fatigue, but we will go into more detail later in this presentation. I always want to know each patient's treatment type and how they've tolerated it. Identified yourself as someone who maybe doesn't have experience with exercise, then extra supervised guidance can be really helpful to make sure you're safe. So normally you'll have an initial consultation. The duration of this will differ clinic to clinic and hospital to hospital, but where I'm working, that's a 1 hour initial consultation. That's mainly a conversation about your medical history. We'll do screening like your blood pressure and make a plan of attack. Then you may have supervised one-on-one sessions, group classes, maybe a combination. This is incredibly vague because the treatment path is often quite unique to the clinic you're at, and we've got people from all different states and territories here today. So these are some options as what follow-up sessions could look like. Face-to-face, one-on-one, group classes, completely home exercise maybe, or perhaps a combination of a home program and then check-ins face to face. And then long term, or at least at the clinic that I work at, some people find that they really like the camaraderie of continuing moving in a group exercise setting or coming in a one-on-one setting. So that's an option. Some like coming in for an occasional check-in to make sure that they're working hard enough to achieve their goals. Or some people like to move on to self-management and doing their own thing long term. In terms of what kind of treatment goals that I've seen people for frequently that might be a bit of a trigger for you to come up with some goals for yourselves. We often see people exercising to help manage their cancer-related fatigue. I often see people with guidance surrounding safe return to activities following surgery for cancer and for assistance with how to get or how to continue exercising safely during treatment. In terms of cancer-related fatigue, if we go into this in slightly more detail, so my fabulous colleague drew this up. Her name's Jo. And how this works is often we'll see people at the start of their fatigue journey where they might be doing a ton of movement, not even movement, they might also be doing a ton of socializing, work activities, feeling okay. They do everything they've wanted to do in their whole life in one day and then they crash. And then they feel better after a few days or a week and they do everything they've wanted to do again and then they crash. We call this the boom bust cycle. And this is a cycle that we want to eliminate or mellow out a little bit more. So I see a patient, they're either doing too much and crashing, or they might be nervous about bringing on this fatigue and staying in what we call the activity avoidance zone. My goal is to bring people into the optimal activity zone. And if any of you are experiencing cancer-related fatigue, I hope that this is reassuring to see that it is a well-established symptom in the scientific literature that we as exercise physiologists see and can help people with. So stage 1 of treatment is identifying what's going on, whether the patient's in an activity avoidance zone or a boom bust pattern. And we want to get you into the optimal activity zone. And how we do that is through activity pacing. So if you think of someone pacing themselves in a marathon, we want to teach people how to pace themselves throughout their day and throughout their week. So for example, if I'm seeing a uni student and they've scheduled all of their lectures on one day, I would try to help them or recommend that they bring out their lectures throughout the week and spread them out rather than doing them all in one day. Something that is important to remember is when it comes to fatigue, physical tasks can cause fatigue, like exercise, but also cognitive tasks can cause fatigue. So listening to me talk today is a cognitive task, talking to your friends is a cognitive task, reading a complicated book is a cognitive task, and all of that can contribute to fatigue. Exercise, or the optimal amount of exercise, is really important in managing your fatigue, but we want to make sure your people aren't doing heaps and then crashing. So we pace the physical and cognitive activities throughout the weeks. And once we've identified this optimal activity zone, we enter the next phase, which is called the graded activity phase. And how we explain graded return to activity is if you're standing in the snow and then you jump in a bath, it's horrible if you do it quickly, but if you get in quite slowly, it's safe. Similarly, if you're sitting in a dark room and you suddenly open the blinds, it's horrible. And if you slowly open them, it's safe and fine. We want to slowly open the blinds with doing more activity. So I might increase by 10 to 20% every couple of weeks how much movement someone is doing until we get them either back to where they were before this fatigue came on or getting back to an activity that they'd like to do. This is what treatment looks like on the exercise physiology side of managing cancer-related fatigue. But it's a really important tool in managing fatigue, which sounds counterintuitive, but the science supports it. So, how to get started with exercise. Like I said, we all know that it's good for us, but starting an exercise routine can be incredibly challenging. And it's important to remember that everybody's starting point will be completely different. And it depends on various factors like your tumor and treatment characteristics, how well you've tolerated your treatment, what exercise you have done in the past, any other illnesses that you have going on or injuries you might have going on. We've had patients sometimes where a recommendation might have been If they wanted to start exercise, the guideline might have been just don't do too much, don't run a marathon. And for some people, they might go, well, I would never run a marathon, that's ridiculous. And otherwise, that other people might go, well, I am a marathon runner, and how can I get back to that? So everyone's starting point is completely different. For one person, starting very easy might be doing very light, no weights at all. And for someone else, starting easy could be holding something like a 7 kilo weight. So please do not compare yourselves to anyone. Start with what's realistic for you. So exercise intensity is completely subjective and unique to each different person. So start with what suits you best. So if I was seeing someone who was not doing any exercise at the moment and wanted to get started with exercise, I might recommend starting with 1 or 2 walks per week for 10 to 20 minutes and 1 whole body strength session per week. A tip that I like to have when you're building a new exercise routine is to have a range. For example, 1 to 2 sessions per week for 10 to 20 minutes. Because if you've had a busier week and you've only done 1 session, that's a win. And then if you've done 2 sessions, that's also a win. And celebrating the wins, I think, is a really important part of building a sustainable routine long term, which is the priority. And then once you've started building an exercise routine with your fitness exercise, your strength exercise, and your balance exercise, you want to work towards the exercise guidelines that I showed before as you feel ready. So for some, it might take not much time. For some, it might take a lot longer, and that's completely fine because everybody is very different with their exercise tolerance. In terms of where to go for support, the Cancer Council website has some fantastic resources. So we have someone here doing a wall push-up. This is a fantastic example of an upper body exercise. And this person over here, I'll move my camera, this person is doing a sit to stand. I'd argue that that's not a super stable chair. Please make sure if you're doing a sit to stand, you use a very stable chair. I do not want the chair moving away from you. But if you would like to get started with exercise and you don't have any bone metastases, you don't have osteoporosis, you don't have diabetes, and you don't have a heart condition, the Cancer Council's website has some fantastic resources of examples of movements to get you started. Now, in terms of access to facilities, or access to services, if you would like extra support, these are actually outdated, but I think they're a really nice explanation as to how these referrals work. You may or may not have seen this before. You don't need this from a GP anymore. GPs can now write a letter, but they used to have to fill out this table. This is now called a CDM referral. It used to be called an EPC. A CDM referral, I tend to still call it that. Now, it is always completely up to a GP if they would like to give you this referral, but each calendar year, if you have a chronic health condition, you may be eligible, up to your GP, you may be eligible to have up to 5 sessions with an allied health professional partly covered by Medicare. All 5 could be with one professional, like an exercise physiologist, or they could be divvied across various health professionals, like a dietitian and an EP, or an occupational therapist and a dietitian. Now, Medicare covers just over $60-ish per session at the moment with this referral, and there likely will still be a gap that will have to be paid for services with this referral. Now, there are some clinics, so in New South Wales as well, there are some private hospitals where if a patient has private health insurance, that insurance may cover the cost. And I say may because the patient might have to pay an excess, but the health insurance may cover an exercise program for people with cancer. So I encourage you to have a look at whether there are any private hospitals, if you have private health insurance and that's something you're interested in, seeing if they do any exercise programs for people with cancer and see if that's something that is covered on health insurance. Private healthcare can, depending on the health fund and level of cover, they may also cover part of the cost of exercise physiology sessions, but there may likely be a gap as well. Now, quite a lot of hospitals, especially New South Wales and Victoria, and I've had a quick look and it looks like there are quite a few Australia-wide cancer-specific exercise programs that are hospital-based in an outpatient setting where you can come in and do your exercise programs. There are a ton of these programs at various price points. I have also had a look on the Cancer Council's website, and if you go on the Cancer Council's website for each different state or territory. There seem to be specific exercise and or some seem to be combined with a lifestyle program or a mental health program that you may be able to access. They do seem to differ state to state, but each state and territory's Cancer Council page has a phone number that you can call to learn more. We all know that the financial toxicity surrounding cancer care is a very real issue. So I highly recommend giving the Cancer Council a call to see what services are available near you, to make sure you're living well with cancer and staying as strong and fit as possible. We've got some references, but this brings the structured part of the presentation to an end.